Chronic Obstructive Pulmonary Disease, COPD, is a progressive respiratory disorder characterized by persistent airflow limitation that is not fully reversible. It encompasses emphysema, destruction of lung air sacs, and chronic bronchitis, airway inflammation, and mucus hypersecretion. As the fourth leading cause of death globally, COPD caused 3.5 million deaths in 2021, with nearly 90% occurring in low- and middle-income countries. 72. Below is a detailed analysis of its causes, diagnosis, and treatment. Phase 1. Causes and risk factors. COPD results from prolonged exposure to irritants that damage the lungs and airways. Smoking accounts for 70% of cases in high-income countries. Risk correlates with pack years, duration times intensity, 107. Environmental exposures. Indoor air pollution, biomass fuels for cooking/heating in poorly ventilated homes, 73. Occupational dust/chemicals, e.g., coal mining, textile industries, 510. Genetic factors. Alpha-1 antitrypsin deficiency, ATD. A rare genetic disorder causing early onset COPD, less than 45 years, 110. Other risks. Asthma, smoking overlap, childhood respiratory infections, and low socioeconomic status, 87. Pathophysiology. Damage includes narrowed airways, destroyed alveoli, chronic inflammation, and mucus obstruction, leading to reduced gas exchange and air trapping, 210. Stethoscope 2. Diagnosis. COPD is often undiagnosed until symptoms worsen. Key diagnostic tools. Clinical assessment. Symptoms: persistent dyspnea, chronic cough with sputum, wheezing, frequent respiratory infections, 35. History: smoking/exposure history, family history of COPD/ATD, 6. Diagnostic tests. Spirometry, gold standard test. Post-bronchodilator FEV1/FVC less than 0.7 confirms airflow obstruction, 611. Imaging. Chest X-ray rules out other conditions, e.g., heart failure. CT scan detects emphysema, air trapping, or bronchial thickening, 16. Additional tests. Arterial blood gas analysis assesses oxygen/CO2 levels. AATD blood testing for early onset or familial cases, 12. Staging severity. Based on spirometry, gold criteria, and symptom burden. Table. COPD stages using gold criteria, 211. Stage FEV1, percent predicted, symptoms, and exacerbation risk. Mild, greater than or equal to 80%, few symptoms, low exacerbation risk. Moderate, 50 to 79% worsening dyspnea on exertion. Severe, 30 to 49% limited activity, frequent exacerbations. Very severe, less than 30% respiratory failure, disability. Pill 3. Treatment. Treatment focuses on symptom control, exacerbation prevention, and slowing progression. Lifestyle interventions. Smoking cessation. Most critical step. Reduces lung function decline by 50%, 14. Vaccinations. Annual flu, pneumococcal, and COVID-19 vaccines to prevent infections, 710. Pulmonary rehabilitation. Combines exercise, education, and nutrition. Reduces hospitalizations by 30 to 60%, 411. Pharmacotherapy. Table. Medications for COPD management, 1411. Drug class examples. Use case. Short-acting bronchodilators, albuterol, ipratropium, quick relief during flare-ups. Long-acting bronchodilators, tiotropium, LAMA, formoterol, LABA, maintenance therapy. Inhaled corticosteroids, ICS, fluticasone, budesonide added for frequent exacerbations. Combination inhalers, LAMA/LABA, e.g., Anoro ellipta, LAMA/LABA/ICS, e.g., Trelegy. Moderate severe COPD. Phosphodiesterase, for inhibitors, roflumilast, chronic bronchitis, with history of exacerbations. Notes. Monotherapy, start with LAMA for mild symptoms, 11. Triple therapy, LAMA/LABA/ICS for severe COPD with eosinophilia, but increases pneumonia risk, 11. Antibiotics. Azithromycin prophylaxis reduces exacerbations in severe cases 18. Advanced therapies. Oxygen therapy. For severe hypoxemia, resting O2 saturation less than or equal to 88%. Improves survival by 30%. 411. Non-invasive ventilation. NIV reduces CO2 retention during exacerbations. 12.
Surgery.
Lung volume reduction. Removes damaged tissue in upper lobe emphysema. Transplantation. For very severe COPD, improves quality of life but not survival. 14. Managing exacerbations. Characterized by acute worsening of symptoms. Treatment includes short-acting bronchodilators plus systemic corticosteroids. Antibiotics if infection is suspected. 17. Glow showing Europe Africa. 4. Prevention and prognosis. Prevention. Avoid smoking/irritants. Improve ventilation for biomass fuels. Early ATD screening. 710. Prognosis. Variable but progressive. Stage 3 to 4 COPD shortens life expectancy by 6 to 9 years. Factors like continued smoking and frequent exacerbations worsen outcomes. 28. Gemstone conclusion. COPD is a preventable yet incurable disease driven primarily by smoking and environmental pollutants. Early diagnosis via spirometry, combined with smoking cessation and tailored pharmacotherapy, can significantly improve quality of life. Global efforts such as clean air initiatives and pulmonary rehab access are critical to reducing its burden. 74. Patients should work with healthcare providers to create individualized management plans addressing both physical and mental health needs.